Hi, my name is Patricia Tennant. I'm the Chief Operating Officer at Kentucky Youth Advocates. And today you're joining a Blueprint policy information session. And so we're going to ask that you stay muted, but we are going to take questions and comments via the chat feature, and we'll try and answer those as we go. Or if not, we'll do it in the chat, or if it's something that we can't answer completely today, we promise to get it back to you later on. So today you're here to learn more about the policies and the blueprint for Kentucky's children. And just to get our brains going, give us an opportunity to connect to one another, we're going to start off by hearing from you all with a few poll questions. So I think if you see in the chat, there's a Menti poll. And we ask that you click that link. And the first question is, we'd love to hear from you, everybody. How many children's advocacy weeks or days from the olden days have you attended in the past? And once you respond, we already see some of those answers coming up. So far, the newbies are winning the race here, or the competition, I guess you would say. Okay. Well, still ahead. Oh, the pros are getting closer. Oh, now it's a dead tie, dead heat. Oh, and then they took over. Okay. All right. Well, it looks like with you all can keep putting your, let's see, 20 responses in. Okay. So I think it's safe to say that we've got a good mix. We have 10 of you have attended at least 3, 2 have one or two under your belt. And the 8 of you, this is your very first. So you get a special welcome. We're really excited that you're here with us today. And hopefully in the future, you can join in person because those are fun too. Okay. And now the next question I see that Melissa put in the poll. Okay, I'm sorry. That's the same one. You can click on to the next question. So please finish this sentence. Every kid, Kentucky kid deserves, fill in the blank. And you can put that in the Menti poll that Melissa just put in the chat. Or you can go to, you can see at the top of the screen, go to menti.com and use that code. A happy childhood. Every Kentucky kid needs love and laughs, a loving home, to have their voice heard and valued, world-class education and healthcare, opportunities, absolutely, to be safe, yes, to be loved, supported, and cared for. Yeah, I definitely see lots of love and safety. Those are themes that I'm seeing here. And opportunity, for sure. Good point by Nails. All of the above. I agree completely. These are all really great answers. Okay. I think now let's move on to the final question. Please finish this sentence. I speak up for Kentucky kids and families because. Let's see, I am not, oh, there we go. There's our first ones. They're worth it, absolutely. I needed someone to do it for me. It sounds like from experience. So glad you're bringing that experience to the table to inspire you to be here today. If we don't, then who will? Absolutely. We have a CASA representative on here. That's fabulous. You're living it out in your daily life. Kelsey, can we scroll down? Looks like, there we go. So many don't know how, or the powers to be won't listen to them because they're from the hills and hollows of Kentucky. I should say hollers. I grew up in Harlan, so I have the right. They deserve a voice in their corner. Yes, I see the word deserve many times. I think we can all agree with that. All right, thank you all for those inspiring words and reminders of why we're all here. Okay, now I'm going to move on to the meat of the discussion. So the primary purpose of Children's Advocacy Week, as you all know, is to build support for policies that are good for kids. And because we hope that you will be advocating, speaking with your legislators this week, but also beyond. This is not the only week. They should be hearing from you regularly. And we want to make sure that you are prepared and ready to do that. So we're going to share the Blueprint for Kentucky's Children policy priorities with you and point out some specific policies that either already have bills filed and moving, or there could be a few that we expect to move. So we're going to share more on that. So you can also find all of this information on the Kentucky Youth Advocates Bill Tracker, and we'll drop that link in the comments. And again, if you have any questions, please go ahead and put those in the chat so that we can either answer them now or we'll follow up with you later. So with that, I'm going to turn it over to my two colleagues, Alicia Watley and Courtney Downs, and they're going to run through an overview of the Blueprint for Kentucky's Children. So Alicia, Courtney, take it away.
Thanks, Patricia. So like Patricia said, my name is Alicia Watley, and hopefully you're seeing our slides up now, but I just wanted to say that this afternoon, we're really going to be sharing a lot of policy information with you. So we have divided it up kind of into two different sections. So first, we're going to go over policies that are on our blueprint but have not yet been filed or become a bill this session. So there's no bill number for you to follow just yet, but there's still a priority that we're working on. And then we're going to share with you some policies that are actively moving. So they've been filed, we have a bill number, and we're able to go ahead and track those and see where they're at. So first, I just want to give a quick overview of what the Blueprint is. I know we had a lot of new people to Children's Advocacy Week on the call. So just to make sure everyone's familiar, the Blueprint really is a coalition of nonprofit, public, and private organizations, and it stands on three pillars that you can see on the screen, and that is thriving communities launch strong families, and strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. And as the Commonwealth works to overcome the impacts of both the COVID-19 pandemic and also address systemic racism, the Blueprint really speaks with a common voice to create brighter futures for all Kentucky kids and their families. So I'm going to move into a few of our policy priorities, and these are, like I said, ones that have not yet been filed, so we don't quite have a bill number yet on these. This first one is to allow city and county governments the option to regulate the use, display, sale, and distribution of tobacco products. That does include e-cigarettes to help curb tobacco use among youth and prevent a new generation from becoming addicted to nicotine. This priority would remove a current state law to allow local cities and counties to make decisions that are best for their communities if they choose to. It would not create any new state laws, and it wouldn't mandate any regulations at the local level. It really just opens up the opportunity, if they're interested at the local level, to make those decisions. And this priority does have its own campaign that we have available on our website. So you guys can check out more and learn more about this one at nixthenext.org or on the KYA website. The next one is really creating an infrastructure that would allow for parents to access up to 12 weeks of paid leave after the birth or adoption of a child. So it's that paid family leave piece. The next one is to ban conversion therapy, and this is really prohibiting mental health professionals from engaging in sexual orientation or gender identity change efforts. So that's really in an effort to protect the mental health of our LGBTQ youth. And you'll also see on this screen as well, allowing up to 15 minutes of school instruction time to be used for children to eat breakfast in their classroom. So this is to ensure that we are having children across the state that are accessing that free school breakfast that they already could be accessing, but a lot of them are not for various reasons and barriers that they're experiencing. So allowing them to eat, a lot of programs are called breakfast after the bell, and using creative ways to let them eat breakfast in the classroom or outside of the cafeteria is just a way to make sure that they are getting that nutrition in the morning that they need to be successful in the classroom. And now I'm going to turn it over to Courtney to talk about a couple more.
Great, thanks, Alicia. So for years, Kentucky has really been in the top 5 for parental incarceration. So we'd like to replicate the primary caregiver bill that passed a couple of years ago in Tennessee. So basically, this would expand judicial discretion and then also the options that they have for community-based sentencing when the defendant is a primary caregiver to a dependent child. And this option obviously promotes family unification as well as accountability for the adults. The next is a juvenile justice bill that will establish a minimum age of at least 12 years old that a child can have a case that's heard in court. And we know that it's really easy to get into the juvenile justice system and much more difficult to get out of it. So this would promote age-appropriate community-based responses over detention. And then the next 2 are critical child welfare policies that both would close loopholes in reporting disclosures or suspicion of child maltreatment. So we want to eliminate the chain of command reporting policies within public and private agencies, meaning if a disclosure is being reported to a supervisor and not to DCBS or another reporting agency, that would no longer be allowed. So we want to ensure that even if there are internal policies that require professionals to notify or include a supervisor in the reporting process, that the proper authorities are also being notified. And then the other is just making sure that any disclosures or suspicion of child maltreatment perpetrated by an employee of a reporting agency is reported to an external agency as well. So in other words, if there is a disclosure that's made against a CPS employee, let's say, then law enforcement or the county attorney will have to be notified in addition to the CPS report being made. And then finally, we want to make a small change to current statute around the time frame for coroners to notify the appropriate authorities of the death of a child under the age of 18. So currently the statute says that they should notify these entities as soon as it's practicable, and we want to change it to immediately and then define immediate as within 24 or 48 hours. So I will go ahead and hand it back over to Alicia, who can start going over some budget items.
Thanks, Courtney. So these budget items are not currently included in the budgets that we've seen from the House and the governor. So the first one is to ensure investments in Medicaid and Kinship to prioritize closing the remaining gap in health coverage for Latinx children. So as we have seen in our recent Kids Count data book, there is a disparity in health coverage among Latinx children. And so we would like to see some additional dollars specifically set aside in the state budget to make sure that we are getting those children insured, getting them access to that health insurance. So unfortunately, we have not seen that, that money set aside in the 2 budgets that have been put out from the House and the governor. The second one here is to boost investments in tobacco use prevention and cessation programming to curb use among youth and also pregnant women across the state. So again, there is an amount that's in there for these programs, but it is about the same as it was in previous years, and that's a cut from several years ago. So we've been seeing this number cut for several years, and we're really trying to get it back to where it was in 2018 and before. So we were hoping to see a boost there, and unfortunately that was not included in the House or governor's budget that has been released. And then the next one here is to protect the current funding for safety net programs, including KTAP, SNAP, and WIC, and ensure that they are not modified in ways that prevent children from receiving needed services. So of course, we want to see investments being made there and making sure that these programs are running and have the funds that they need to do so. And then Courtney, if you want to talk about a few budget priorities as well.
Yeah, sure. So I'll start with childcare. I think it's really important to point out that 40% of working age Kentuckians cited a lack of childcare as a reason for not being able to work this year. Also, half of all communities in the state are childcare deserts, meaning families have limited or no access to childcare. So we really want to build an infrastructure that improves access to affordable, high quality care so that parents can work and that local economies can grow. Next, we want to expand investments for child abuse forensic services, and there are multiple asks that we have here. So the first one is we want to ensure that the child advocacy centers, as well as the rape crisis centers who provide important medical and clinical services to children who have experienced sexual abuse and assault, have the funding they need to provide those services wherever they're needed. Secondly, we want to include the child abuse pediatricians and their teams who work out of the pediatric departments at U of L and UK. They are equipped to provide, similar services to victims of child sexual abuse and assault, but they also have extensive training and expertise on recognizing the signs of child physical abuse, especially in young children who are unable to verbalize what happened. And they have that expertise in treating it. So when we think about the high rates of maltreatment that we see in Kentucky, it's critical that they receive funding to continue to provide these services, and then also to expand to more easily reach kids across the state. Finally, we want to increase the reimbursement rate for pediatric sexual abuse forensic examinations. This rate has not been adjusted in decades, so they need to see an increase so that there aren't any barriers at all to providing those critical medical exams. And I will hand it back over to Alicia to get us started on what's happening now in the General Assembly.
Awesome. Yeah, so now we're going to go through the rest of the blueprint in terms of what's already been filed, that we actually have a bill number that we can give you all and tell you how to follow along. So the first one that I will mention is to increase Medicaid funding to support health coverage for mothers up to 12 months postpartum. So we know that after having a child, it can be a very vulnerable time for a mother, and they really just have a lot of ongoing needs and want to make sure they're getting the critical care they might need after delivering a baby. And so right now, a lot of women that are on Medicaid will lose that coverage like 60 days after delivery or after having a baby. And so we're wanting to make sure that that is extended out to 12 months postpartum. And so then there's no gap or halt in their care. So we have seen a bill filed on this, which is great news. So that's House Bill 174. It is Representative Cantrell is the sponsor of that bill. So this is really just allowing for that coverage to go up to 12 months postpartum. But one note with this is that we have not seen dollars set aside in the state budget, the proposals that we've seen from the House or the governor's budget specifically for this. So we will need funding to support the Medicaid coverage going up to 12 months. So that's something that we're going to continue to be talking about and trying to make sure gets included in the final state budget. The next one here is to increase funding for our family resource and youth service centers. And that is really, as you all know, the critical person in schools who work with families to remove barriers to student learning. And we know that they are so important to so many families across the state. And we are very happy to see that this year, both the House budget and the governor's budget proposals did include an increase in funding for those friskies. So you'll see on this screen, House Bill 1 is the House budget proposal, and House Bill 285 is the governor's budget proposal. So if you're interested in looking more into what's included in either of those are the bill numbers where you can actually find those budgets. The next item here is to continue funding for full day kindergarten as an investment in early education outcomes. So a couple of things here. We have one bill, which is House Bill 66, that has several sponsors that you can see. And that is actually the legislative part of making sure that full day kindergarten is a requirement for all schools to be offering. And then we also see in House Bill 1 and House Bill 285, both the budget proposals, that there is funding included to make sure that schools can offer full day kindergarten. So very exciting to see all that included. We've also prioritized an increase in the per pupil funding, which is called SEEK funding, in schools to ensure that public schools can help all kids learn. And again, we did see that highlighted in both House Bill 1 and House Bill 285, both budget proposals. And the last one here is to increase funding for school-based health professionals to make sure that students can access the school-based behavioral health services that they need and make sure that they're able to learn. So we did see this included in the governor's proposal. There's an increase there. Unfortunately, we did not see that outlined in the House budget proposal. So that is something that we're going to continue to be talking about and advocating for to be added in the Senate, hopefully the Senate budget proposal, and also in the final state budget as it is finalized at the end of session. So with that, I'll turn it back over to Courtney one more time to talk about some additional items.
All right, thank you. So I'll start with House Bill 83, and this one ensures that victims of domestic violence, dating violence, sexual assault, and stalking are not prohibited from receiving unemployment benefits if their reason for not working is directly related to the abuse, assault, or stalking. This bill also has a training requirement for anyone who processes these claims, and a report has to be submitted to the legislature on the number of claims that they processed annually. It is sponsored by Representatives Kulkarni and Heverin, and it has not yet been assigned to a committee. And then the next items are included in both the House and the governor's budget, which is a good thing. First, protecting funding for the HANDS home visiting program, which provides free and voluntary services for new and expectant parents who are seeking support and education throughout their pregnancy and for the first 2 years of their baby's life. And the second will bolster investments in the DCBS workforce to hire more frontline workers who will improve outcomes for the most vulnerable children in the state. So I know that's a lot of information all at once. I am going to pass it back over to Patricia, though.
Thanks to you both. And yeah, I will repeat, that was a lot of information and we moved really quickly through it. The good news is this is being recorded, so you can go back and listen a second time. But also would point out, Crystal included a link to the bill tracker. That's a really great tool that if you haven't checked out yet, please bookmark that. You can go back and that'll help you keep tabs on what's been filed and what's moving. We are also here for you as a resource. So I haven't seen any questions in the chat, but please don't be shy to reach out to any of us. And we want to make sure that you feel prepared and ready to advocate for these priorities alongside us. Before we go, I want to give a quick shout out to the many Children's Advocacy Week sponsors. You can see their logos here in the screens next to me. They're next to me on my screen. And you can check out the full list on the website or in the app, which I think we've linked to both of those in the comments here. And I'd like to also include now a short message from our presenting sponsor from United Healthcare.
Welcome, and thank you for taking time to participate in the important work of Kentucky Youth Advocates. My name is Krista Brinley-Hensel, and I'm the United Healthcare Community Plan of Kentucky CEO. And I'm a mom of twins, so I can personally attest to the challenges of parenting. Keeping children safe and strengthening families are fundamental components of living a healthy life, and it's UHC's mission to help people live healthier lives. Kentucky Youth Advocates and United Healthcare began partnering in 2018 when we launched the inaugural Kids Count. Many local communities have leveraged the toolkit and collaborative funding to bring parenting programs to their counties. Foster care and youth needs are on the rise in Kentucky, and children in foster care tend to have greater physical and behavioral health needs than other children. Our goal with Kentucky Youth Advocates is to reduce the number of kids in foster care in each county by 25% before 2025, and to support the healthy development of kids throughout the Commonwealth. So thank you. Thank you for joining us today. Thank you for participating in the important work of supporting Kentucky's youth and their families.
Awesome. Juanita, I saw your question in the chat. Yes, absolutely. We are working with the Division of Child Care and the Governor's Office of Early Childhood. So That was an easy question. Yes, so what do you do with this? Take action today and contact your legislators. All the tools are ready for you, and we encourage you to use them. The bill tracker, the blueprint fact sheets, all of the talking points. And again, we are here as a resource, so don't hesitate to reach out. Thank you so much for joining today, and thank you for all you do for kids and for speaking up for them this week during Children's Advocacy Week and beyond. So that's it. Have a great day, everyone.